Statement of fact number 17. Dr. Buttar testified that he does not treat cancer. However, the evidence showed that Dr. Buttar held himself out as a physician who treated cancer and that he sponsored numerous seminars to teach other physicians his method of treating cancer. This is the one that I just addressed, but I also want to go on to say that our treatment of patients has had enough success that has garnered the interest of many different doctors who have asked us if we could, if they could come and either shadow me and or spend time at our clinic, and that's why we started teaching the class. And these courses, just so that the viewer understands, were completely put together using the ACCME guidelines and adhere to every criteria and standard that they had to become approved by CME, accredited as CME, continuing medical education at the highest level, the American Medical Association Category 1 type of accreditation. We not only got this accreditation, but we did it in a manner that was above and beyond what other people do, and we were ranked highest that Charlotte A had ever ranked any evaluation program for that particular year. And despite having independent audits, despite having no exhibitors at our conferences, after 1 year and getting the highest marks back from the physician attendees, our accreditation was dropped by Charlotte A. Why? Because the director of the Charlotte A. program, Don Carpenter, told me after four calls to me to find out why did they drop our accreditation, that the medical director of Charlotte A. at that time told her that if she did continue to accredit my course, the AMSPA medical training program, that she would lose her job and that he was getting pressure from the North Carolina Medical Society. This is a type of manipulation of the information that they don't want to play on even terms. If you do everything based upon their standard and you do everything above and beyond and you do everything the right way, they will still come down and try to undermine the scientific basis of what we're doing. You don't need to be a rocket scientist to see a patient that can't feel their feet and can't get up and walk because of the peripheral neuropathy that they have and because of the atrophic changes that they have because of lack of vascular supply to that particular extremity. And then in 6 months, where that person's limb is completely back to normal and normal vascular supply and they're walking on it, they can feel their feet again. You don't have to be a rocket scientist to be able to see that that person's leg improved. Why is it that the medical board is saying that I treat so much? Haven't they ever heard of supply and demand? If I was such a crook and if my patients weren't getting better, do you think that I would still be in business after 11 years and having grown steadily every single year? Why would that be? That you don't think that people are smart enough to know that if I wasn't any good that they shouldn't be coming to me? That's called supply and demand. If I was a bad doctor, I would have already had patients that would have stopped coming to us. But the truth of the matter is that we have grown in popularity. We have gotten patients coming from every continent, over 30 countries, and I don't advertise in any of these places, yet I have patients coming there. Why? Why? Because the patients have seen the results, because they have witnessed the improvements themselves. So no matter what the medical board does or threatens, they can't stop the patients from coming here. So now what do? They try to take the two areas that we have been the most successful in, the areas of neurodegenerative disease in children, i.e. autism and autism spectrum disorder, and cancer, and try to tell me that I can't see patients with cancer and I can't see patients with autism. That's what their entire agenda is. And their deal that they just proposed to me was that they will leave the kid part alone. I can continue seeing children and they won't even suspend my license as long as I agree to stop seeing cancer patients. Again, why would I agree to stop seeing cancer patients? If I did, I would be basically admitting something that they want me to admit, which is that our treatments are not working, and our treatments do work. I would have to tell the patients that have been coming to me with cancer, who are still alive today, 3, 4, 5 years after their diagnosis and told that they were going to die, but they're still alive today. I would also have to tell these patients that I can't do your maintenance treatments anymore, and I would essentially be signing their death certificates. And that is not something that I can or am willing to do. So the medical board, if they want me to stop, they got to take my license away.